Hello, this is Shadi Reyes from Wayne State University, Detroit Medical Center. Today was the pre-course of CVI 2018 in Denver, Colorado. With me is Sean White. He is the winner of the Shark Tank, and he presented to us a new device called FlowMet. Welcome, Sean.
Thank you very much for having me.
Yeah, congratulations, first of all, for winning the award.
Thank you.
Well deserved. Can you please tell us about the device?
Sure. So our technology is relatively simple. So what we've done is we use a light-based technology to measure blood flow or perfusion in the tissue in real time. And we do that using a compact device. It's about this big. It looks like a pulse oximeter. And we're able to measure, using light, perfusion in the tissue continuously. And what we're using that technology for is to measure the changes in perfusion that happen during revascularization surgeries to treat peripheral artery disease.
So the device will detect if the procedure is successful by opening stenosis or not.
Yeah, that's exactly right. So what we've seen in the data that we've collected so far is that when you open up those stenoses, you'll see the corresponding increase in perfusion. Or alternatively, sometimes you open up a stenosis and you might expect an increase in perfusion, but what you don't see is any change at all. And that's really the value here, is that we're able to quantify what the efficacy of what the individual action actually is and provide that new type of feedback to clinicians.
So it's a real time during the procedure in a sterile field, and it's give feedback to the operator.
That's right. It's real time, continuous, and we're continually providing those values and that feedback to the clinician in the sterile field.
Nice. And at what phase is your device now? Are you in the concept? Are you in the clinical trial? Or where are you now?
We've actually conducted several clinical trials. We have data from more than 250 patients to date. But right now, we are pre-510K clearance. We're expecting that to come in about 6 months' time. But clearly that hasn't stopped us from collecting a pretty healthy body of non-significant based risk data.
Yeah. In terms of safety, can you talk about it short?
Yeah, absolutely. I mean, the reason we were able to collect that body of data is because we have a non-significant risk device, which has been designated by several IRBs. The device is completely non-invasive. All it does is use light, essentially, to measure tissue. So we send in a really low-power laser beam. That light scatters around the tissue, and we collect it using a detector, and it's as simple and non-invasive as that.
So we can say it's similar, almost like a pulse ox on the finger.
Yeah, that's exactly right. So the technology we use is dramatically different. However, we actually made the form factor very similar to a pulse oximeter because it's very familiar to clinicians, and it's very simple to use. You clip it on, and the measurements are continuous. There's no intervention which is necessary. And we really wanted to stick to that level of simplicity to have the kind of clinical traction which we were looking for.
And this is, given the fact it's peripheral device, can be done in an outpatient lab and also in the hospital.
Yeah, that's exactly right. And in fact, a lot of the data we've collected has been in those outpatient labs.
Yeah.
So right now, we're really focused on intraoperative monitoring to provide that real-time perfusion feedback. However, we think there's additional value that we can use the technology to diagnose with a greater degree of sensitivity and specificity both peripheral artery disease as well as start doing a more detailed analysis of disease severity and identifying critical limb ischemia as well.
Well, it sounds to me it's very simple, safe, and portable device, can be done in any side of the hospital or outpatient. And it gives a lot of information to the operators. Congratulations for winning the first award. I mean, well deserved.
Thank you.
And thanks for being with us. Please watch these videos and the other videos on the CV Innovation channel, as well as follow the hashtag CVI2018 on Twitter. This is Shadi Reyes from CVI 2018.